In this short talk, I just want to illustrate a sign that I call the sublingual hematoma sign. It's a sign that I hope will help identify some subtle non-displaced mandibular fractures. So I'll just cut to the chase. Here's a axial section CT in bone windows, not great bone windows, but here's a fracture. So obviously when I show it on one slice, it's obvious. You may think, oh, I wouldn't miss that, or how could I miss that? But if there's a lot going on, you're busy, there's other fractures that are more obvious, you may overlook this non-displaced fracture here, especially if you've never seen a non-displaced fracture in the mandible. You may be used to seeing very obvious fractures, and this may just slip your attention. So one thing I want to point out is something that will be better shown in soft tissue windows. This is the same slice shown in soft tissue windows. One thing I want to point out is just lingual to the posterior body on the right, there is a fat pad. It's a fairly reproducible fat pad from scan to scan. And there's other fat pads as well, more anteriorly on different sections, superiorly or inferiorly within the floor of the mouth. But pay attention to these fat pads and pay attention to any asymmetry. So here you can see the fat pad is on the right, but on the left, it's gone. This usually represents a sublingual hematoma. And when you see a sublingual hematoma, at least clinically, in the setting of trauma, even if the occlusion looks okay, it usually means there's a non-displaced fracture. So this is an important finding. Here's a figure demonstrating this sign. Both in soft tissue windows and in bone windows, you can see that there's an absent fat pad in the left posterior body, just lingual or medial to the posterior mandibular body within the floor of the mouth. And this corresponds to basically where the non-displaced fracture breaks the lingual cortex in the left body of the mandible. And this is what I'm calling the sublingual hematoma sign, and it's a sign that indicates a non-displaced mandibular fracture.